turning to a serious note now, many people move to South Florida or vacation here because of our beautiful beaches and our hot sunny weather, but they may not realize that living in the Sunshine State exposes them to harsher UV rays, which is very damaging to the skin. We have Dr. Deborah Longwill here, dermatologist at the Miami Center for Dermatology, to talk to us basically about how to take care of your skin and signs that there may be a problem. And winter doesn't mean lay off the sunscreen, right?
Correct. At Miami Center for Dermatology, what we do is we make sure that the patients are checked once a year, full body checks. We check with our dermatoscope, and we educate on sunblock. The sunblock that we discussed should be with titanium or zinc oxide. And it should be reapplied if you're out in the sun. What we do to look for skin cancer, just to educate everybody, because it is a little, it is dangerous. If you happen to get something like a melanoma, and you want to catch it early. So what we do is we check the body, full body, with the dermatoscope, and we make sure that the melanoma is non-existent. And if there's some type of spot there, then we go ahead and we biopsy right away.
Okay, so as far as spots go, I mean, freckles, what are people looking for? I've heard things like asymmetrical or ragged-looking edges. I mean, what do you...
What we're to remember is A, B, C, D, E. A, it's asymmetrical. B, the borders are irregular. C, the color could be gray, blue, white. D, the diameter is usually larger than a pencil eraser, but that doesn't count. You could have a little new small black speckle somewhere. An E, an evolving mole, a new mole that's been brown or then it turned it black. So those are signs for the melanoma. But for basal cell, you're looking for a pearly type of growth that looks like a pimple all of a sudden on your nose or on your cheek, or a squamous cell that's more crusty or bleeding, and it doesn't heal.
Oh, very interesting. And these aren't just in areas that are exposed to the sun. These can be on the scalp. These can be in other places.
Yes. And when we do the full body checks, we check the scalp, we check the back. You can't really check your back in areas that you don't really... that's not exposed to the sun. Then we check in between the toes and the hands.
How often does someone go back for a check? Because I'm assuming these types of things can probably develop quite rapidly.
Yes, we recommend that the patients come back once a year. If a patient has had a history of skin cancer or they have a genetic predisposition for skin cancer, we recommend at least 2 times to 3 times a year.
And you were telling me earlier that skin cancer does not discriminate.
No, we're actually seeing about 3 to 4 melanomas a week, and it doesn't matter. We've seen 20-year-olds, we've seen 40-year-olds, and we've seen in the elderly in the 80s. It doesn't discriminate between men or women. It doesn't discriminate nor skin color.
So what is a visit going to be like? Because I know you focus on relaxing the patients a lot. So what would a visit involve?
Well, first of all, in the waiting room, there's a wonderful waterfall. There's orange water and really nice music, and there's a fish tank and beautiful things all around with flowers, and every little part of the office that we created to make the patients relax. Is all detailed. And then when the patients come into the rooms, they're put into a cloth gown, not a paper gown.
Very nice.
And then we check the patient's head to toe. Basically nowadays you can go any doctor's office you want with your whatever your copay is, but you might as well go to a place where it's much more comfortable and beautiful, and you're relaxed and you're not so scared.
All right. Thank you so much for being here. You can actually visit Dr. Longwill at Miami Center for Dermatology at 7700 Southwest 104th Street in Miami. For appointments, call 305-279-7546, and for more information, go to miamicenterfordermatology.com.